Compton, and I understand you're applying for the position of RN today?
Yes, ma'am. My name is Scarlett Jones, and thank you for letting me do this interview today.
Great. Okay, I just have a few questions to go over with you today regarding this job application. The first question is, please tell me a little bit about yourself and how your past experiences relate to the job for which you're applying for today.
Okay, well, my name is Scarlett Jones. I am CPR certified, AED certified, and first aid certified. I currently took an EMT class in high school, and I got to do hands-on job-related situations. I got to experience riding in an ambulance, caring for patients in an ambulance, and I also got to work in an emergency room setting. I shadowed a registered nurse, and I am currently a student at Calhoun Community College, and after my 2 years I plan to transfer to the University of Alabama in Huntsville and complete 4 years of college and become a nurse practitioner.
Okay. The second question is to describe a difficult work-related situation and how you overcame that problem.
Well, I was a lifeguard for 3 summers at Point Mallard Campground, and on my first summer, it was probably my 3rd or 4th day of work. I came up on a patient that had fallen, and he was unconscious, he wasn't responding, and I remained calm, but my role was I was the primary person, which is the person that does everything. We check their pulse, their breathing, everything, and I remained calm. That's mainly how I got through that situation. And I immediately called for backup. I went and got the backboard, which is what we place patients on that might have a spinal or neck injury. And I looked at everybody around me and I made sure that somebody called 911, and I even got to help put them in the ambulance, and it was really interesting. But I got through it because I remained calm.
Okay, the third question. Give an example of a successful project you were a part of, and what was your role in that project?
Okay. I was actually doing a clinical for the EMT class I mentioned earlier, and a lady had dementia, and she thought that she saw birds on her porch, so she tried to swing at them with a broom, and she wound up falling, and she had a big hematoma right here on her head, and she was very out of it. And as soon as we got there, she had urinated on herself, and I helped her. She only wanted me. She didn't want anybody else in the room with her. And as soon as we started walking to the ambulance, she passed out. And I immediately did something that we called like a scene size up, and that's when you check their breathing and their pulse. I immediately did that, and as soon as she became conscious and back to it, we explained what happened because she immediately started freaking out. But I was also the primary person in this role too, and I got through it because I stayed calm, and I also wasn't alone. And the 2 guys that I was shadowing were very proud of me and how I handled the situation, and because they said that they probably would have been nervous, and the house was very tiny, so it was very hard to maneuver her through it. There were a lot of antiques, but we made it through.
Okay. The fourth question. Why should we have you be considered for the position of a registered nurse here?
Well, it's because I am a very caring person. I usually remain calm in most situations, and I never try to panic because panic brings chaos. But I knew that I was put on this world for a reason, and that was to help people. And all of my family members always tell me that I'm a very caring and calm person. And as soon as I started doing my lifeguarding and helping people, that's when I realized I want to be a registered nurse because I loved helping people. In my career of lifeguarding, I had 36 saves, and I feel like I'm very applicable for this job.
Okay. And the fifth question, do you have any questions about the job for me?
Well, as a registered nurse, would overtime be required for it?